Hello, I'm Melanie Tipples. I'm a consultant obstetrician and gynaecologist, and I work here at St Richard's Hospital. Within the obstetric and gynaecology department, we have 9 consultants, 1 associate specialist, 6 middle tier doctors, and 8 first tier doctors.
I'm Charlotte Gumalatsu. I'm an ST6 in Obs and Gynae, and I've been at St Richard's since 2014. I had a break having a baby, and then I came back in April last year. My day-to-day job, it varies from day to day, but generally on a Monday I would have clinic all day, so antenatal in the morning, gynaecology in the afternoon. We have a whole day theatre list on a Tuesday, so I'd come in at 8 o'clock to consent the patients and then spend all day in the theatre and then see them post-op. And then Fridays I quite often do another antenatal clinic in the morning, and then we have teaching on a Friday afternoon. On top of that, I also have nights every 6 weeks and long days and weekends, during which time I would mostly be on labour ward, but also cover gynae.
My name is Adam Jones. I'm one of the current Foundation Year 2 doctors working in the Obs and Gynae department here at St Richard's Hospital. Every morning at 8:30 there's a handover meeting where we all gather, we discuss all the patients that are under us.
This is the handover room. We meet here at 8:30 every morning and hand over with the consultant on call, the night and the day team, as well as the midwife coordinator. And we do obstetrics handover first, and then after that handover gynaecology.
If you're the labour ward SHO, you need to hang about because you're required to assist with any caesarean sections happening that morning, and then you go and do a post-natal ward round downstairs and see all the 3rd-degree tears and caesarean sections which happen the day before, and make sure that they're safe to be discharged and take care of any discharge letters or any other little odd jobs down there. And then you're on standby for the rest of the day, sort of going where you're needed, when you're needed. So the workflow can be a bit variable, but that's quite nice really. And in terms of the gynaecology, you go and do a ward round of the gynaecology patients, and then a bit also you're on call sort of waiting. And if it's the early pregnancy clinic you're covering, you're in the position where if ladies get unfortunate news on their scan about their pregnancy and it's a miscarriage, you're often one of the first people they speak to and sort of responsible for coming up with a sensible plan to guide them through the next steps.
Within the department, we deliver both obstetrics and gynaecology, and this is delivered in the majority within the women and children's block. Emergency patients for obstetrics arrive to the labour ward for assessment.
This is one of our labour rooms. They're all fairly standard in that they have the bed, the CTG machine, an OBS machine and a resuscitaire, and then all of them will have in one corner or other a chest of drawers containing things like cannulas, a delivery pack, towels, Inco pads, etc. If you need to do an instrumental in one of these rooms, there is a trolley containing everything that you need that one of the maternity support workers will bring down to the room, and it's the same with perineal packs. This is the ground floor of the women and children's block. This is where EPAC, antenatal clinic, gynae clinic and the day assessment unit all happen, and we also have the children's outpatient department and the consulting rooms down here as well. This is the early pregnancy assessment clinic. Women come here in the mornings and the clinic runs from about 8:30 in the morning until 12:30. It doesn't run at the weekends. We have the ultrasound room here, and then on the other side there's the doctor's office where patients go afterwards if they need to speak to anybody.
Emergency gynaecology patients will be seen in the accident and emergency department in the main part of the hospital. Gynaecology patients after surgery are looked after on many of the wards, but often reside on Chilgrove.
We are on the 3rd floor of the Women and Children's block. We're in the secretaries and consultants' offices, which are all situated on labour ward. This is the junior doctor's desk. It's for use by all SHOs and registrars. It has a computer and a laparoscopic box trainer, and we also use it to do our admin.
One of the SHOs manages the SHO rota. Any sort of locums or complicated swaps might need approval by the consultant who's overall in charge, but generally it's quite flexible and people are quite happy to help out and facilitate things where they need to.
The SHO rota, you're divided into doing, it's generally several days at a time. So you're either doing gynae or EPAC, where you have a clinic week, a theatre week, or you're on call on labour ward or on nights. And I think there are 6 slots for SHOs. So they very much have the same job every day. But the registrars, I'm responsible for the rota at the moment, and you get rotated into either doing clinic, theatre, or on call or nights or special interest sessions, and that can change between the morning and the afternoon and from day to day. It's roughly 1 in 6 that you'll be expected to do nights, weekends or long days. And our long days on the reg rota happen in a block of 4, followed by a block of 3 long days at the weekend. And the nights are over the course of about a week, but they're split into 2 bits, because we also have resident on-call consultants that cover a Tuesday and a Wednesday night, as well as 5 weekends each a year of long days.
It's quite a generous rota in my opinion, in that when you're on call, you're busy, but the work is manageable, and you're either doing a week of covering labour ward or the gynaecology on call, which is separate. When you're covering labour ward after 5 o'clock, you cover everything else as well, but there are also weeks in the rota where you're allocated to theatre time, clinics and education. And people are generally quite supportive about you doing other things and exploring other interests as well, so long as your day-to-day work is covered.
Alison Crocker, who's the college tutor for the St Richard's side, sends a weekly educational matters email to all trainees, which you will receive on your trust email. This will give you the opportunity to plan your week both with your clinical commitments and to attend as many educational meetings as you can fit in.
There's lots of departmental teaching that happens on a weekly basis, and sort of meetings within the department for the various sort of subspecialty things. So there's a perinatal meeting with the paediatric team where we discuss all the difficult sort of perinatal cases. There's a maternal medicine meeting where we discuss problems related to that. And on top of that, there's weekly teaching for SHOs in addition to the foundation programme teaching that happens here in the Medical Education Centre.
During my rotation here in Obs and Gynae, I would say my learning curve was way high because of the fact that you get to learn how to do speculum examinations effectively, which are obviously very much required for a GP trainee, especially being a female GP. We learn how to do smears, how to do swabs, how to deal with all the problems that the females present with, like problems of discharges, PV bleeding, lower abdominal pain, irregular periods or heavy menstruations. So basically you learn a lot about that, and all through my rotation in Obs and Gynae, I've become more and more confident about dealing with such presentations in patients, and I think this would help me a lot when I'll be working as a GP. There's also weeks in the rota that are dedicated to education, clinics and theatres, so you actually get time to go away and see obstetrics and gynaecology in the outpatient setting and in theatres and get a sense for the specialty as a whole, rather than continually being on call or continually on a never-ending ward round.
As part of your educational supervision, you will discuss a personal development programme for the time you're attached to the department. On a day-to-day basis, you will receive feedback from the consultant on labour ward about the management of the patients you have looked after. And it is important, if you have not received feedback and wish to be advised, to discuss that with the consultant on call or your supervisor.
In terms of feedback on how you're doing in obstetrics and gynaecology, it's quite a senior-led specialty, so normally people are checking on what you're doing and making sort of recommendations. Is there anything you've not considered or things you need to do? If you don't get feedback, you just need to ask for it. People are more than happy to tell you how you can do better, and it's never really critical. It's more of just, oh, maybe next time think about this, and it's actually really helpful.
Hi, my name's Anna. I'm one of the speciality coordinators or medical secretaries. We're here if you've got any queries about where the consultants are, booking appointments, sort of here just to help with anything really. We're based up in the office on the 3rd floor on labour ward.
It can be daunting when you start being on call in obstetrics and gynaecology. It can be not difficult, but the obstetric registrar's priority is labour ward, and that's where sort of the most of the priority is. So sometimes you can feel a bit isolated, but really you are quite well supported, and it's just sort of confronting that initial, I've probably not done obs and gynae for 2 years, and just getting stuck in and getting used to it, and after a week or so you feel right at home, and you can always discuss things with people. There's always help when you need it.
Sometimes in the EPAC clinic, when we have to break bad news of miscarriages to patients, we did initially, when we started, we were sitting in clinics with our seniors, so it was very helpful, so that like we can get a gist of it, how to approach the patient and how to break bad news. And also, while you're working in a clinic, if you have problems or if you're not happy to break the bad news to the patient, then we have assistance of our seniors, like registrars or the consultants can always come down and assist us.
In terms of supporting the more junior trainees, I'm always more than happy to supervise things like surgical management of miscarriage, caesarean sections, instrumental deliveries, perineal repairs, because I think that's a really important part of learning, and obviously they're sign-offs if they're a trainee, but equally with the F2s and GP trainees, we work quite closely together to make sure they get their mini KEXs and CBDs done as well, and also they have quite a few DOPs such as speculum examinations. I think all of us will happily supervise to make sure they get their curriculum.
As you can see, I'm wearing green. This is what we wear when we're covering labour ward. When there's an emergency on labour ward and we're going to theatre, then we need to change into the red scrubs that can only be worn there. But the rest of the time we have to be dressed fairly smartly because that's respectful of the patients. The microguide is really helpful, really useful. If you're ever not sure what to do about a patient, or you're kind of a bit rusty on how to manage a particular condition, there are lots of guidelines in obstetrics and gynaecology if someone's not immediately to hand, so you can look up what you need to do and start doing that, and then discuss it when you've got time or there's someone available later. The hospital uses an electronic prescribing system. By and large it works pretty well. There's the odd little kink that you've got to figure out exactly how to do it, but the more you use it, the more you encounter them, the more you get around them. Nothing is a brand name on the electronic prescribing system, so sometimes you have to look up the generic name for your drug in order to prescribe it, but it's quite straightforward to use once you've got the hang of it.
The Obs and Gynae team here is lovely. Everybody from consultants to the midwives are like very friendly, very cooperative. They will help you, always readily available, very approachable. And the consultants are there for you 24 hours. You can just call them directly. And they're very friendly. Like even if you call them in the night, they'll be so happy that we've called them and asked them.
It's been a really useful rotation because it doesn't matter what specialty you're going to go into, there will always be pregnant women and people with gynecological problems being managed there. So it's been really nice to familiarise myself before I go further in my training.
Everybody's so supportive and everybody knows each other very well. And so you're not ever really lost in the system. There's always somebody keeping an eye out for how you're doing. I've found here that my gynae operating has really come on. Partly because I've been able to work with the same person all the way through, and I think that's really helped. So it's been more like an apprenticeship.
We're all delighted that you're coming to join us here at St Richard's in the Women and Children's Department. We know that you're anxious about attending to be with us, but we're sure that you will have a very enjoyable time while you are with us. If you do have any specific concerns that you'd like to raise prior to joining, please do not hesitate to contact me or one of my consultant colleagues.
So it's a busy rotation, it's very well supported. Be prepared to work hard, but let me tell you, it's worth it.